My name is Kathleen Amos, and I work at the Public Health Foundation, and I'm joined by my colleague, Vanessa Lammers, and we are pleased to be hosting this webinar on behalf of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, or CDC. We have a fantastic webinar planned for today and are very much looking forward to sharing it with you. So as we get started, we just wanted to go over a few housekeeping items for the webinar. On the slide, you can see an image of the attendee control panel, which you should also see on the right side of your computer screen. And this control panel is your hub for interacting with the webinar. So first, in that control panel, you should see an audio section, and you have two options for accessing audio for this webinar. You can either listen through your computer speakers or call in over the phone. If you're using your computer speakers, please choose the computer audio option. If you're using your phone, please choose the phone call option and enter your audio PIN, which is also found in that audio panel. Please make sure to select the audio option you're using, and if you choose to listen over the phone, please also be sure to mute your computer speakers to reduce any echoing. Regardless of which option you choose, all webinar attendees are muted. The slides for today's presentation are available for download in the handout section of the control panel. Links included in the slides are not live during the webinar presentation itself, but they are live in that handout. So if you want to visit those links, please download a copy of the slides. Throughout the webinar, please submit your questions or comments for the presenters via the questions box in your control panel. Please feel free to send in your questions at any time, and we will address as many as possible during the Q&A session at the end of the webinar. If you have any difficulty with any of the technology for the webinar, please also use the questions box to send us a message and we will help you troubleshoot. And finally, we just wanted to let you know that this webinar is being recorded and the archive will be available following the webinar. Pediatric vaccine ordering and administration have declined during the COVID-19 pandemic as parents have stayed home. Maintaining routine childhood immunization is essential in order to prevent outbreaks of preventable diseases. During this webinar, we are joined by two speakers from CDC's National Center for Immunization and Respiratory Diseases who will discuss how to strengthen vaccine competence among parents and ensure safe well visits. First, we have Dr. Sarah Sheely, who is the Education Team Lead with CDC's Immunization Services Division. Dr. Sheely is a graduate of the University of Missouri School of Medicine. She completed her pediatrics residency at Pennsylvania State University and her preventive medicine residency at SUNY Stony Brook. She received her MPH from Columbia University and her MBA from Long Island University. Dr. Sheely has been with CDC since 2007 when she joined as an Epidemic Intelligence Service Officer. Prior to that, she served as the Director of Performance Improvement for the Suffolk County Department of Health Services in New York. Then we'll hear from Jessica McNeil, an epidemiologist at CDC. Ms. McNeil is the Deputy Executive Secretary for the Advisory Committee on Immunization Practices, or ACIP, where she is focused on providing technical assistance to ACIP work groups and supporting the development of immunization recommendations for the United States. Prior to this, she worked in the meningitis and vaccine-preventable diseases branch at CDC for 9 years, where she worked primarily in the prevention and control of meningococcal disease and led the ACIP meningococcal vaccines work group. Welcome, Dr. Sheely and Ms. McNeil. And before we dive into the content of their presentations, we do have two quick polls to help us get to know a little bit more about you all in the audience as well. So I'm going to turn it over now to Vanessa to take us through those.
Thank you so much, Kathleen. So we have two polls. The first poll is, what type of setting do you work in? I'll launch that now. And the voting may be on your GoToWebinar control panel, which sometimes docks on the right, but also might be on the direct screen, depending on what version of GoToWebinar you're launching. So we'll give everyone just a minute. We have pediatrician office, family practice office, health department, FQHC or community clinic, or other. And if you are an other, go ahead and chat in the questions box what type of setting you work in. I'm going to go ahead and close that poll, share the results. So it looks like we had the majority of folks, over 40%, chose other, and then 30% chose health department. Then runner-up in third place was FQHCs or community clinics. And then we just have one more poll. What is your profession? We'll launch that, give everyone just a minute. Again, sometimes the voting is on your GoToWebinar control panel. Sometimes it's a little pop-up. Excellent. We've got over 70 people, over 70% have voted, so I'll go ahead and close that poll, share those results. So most of the folks in the audience today are nurse practitioners or nurses, RNs, LPNs, and then also health educators or communicators are about 25% of the votes. Also a sizable amount of program managers. Great. Well, now I'm going to pass it over to Dr. Sheely.
Thank you. Thanks for the opportunity to be virtually with you this afternoon to speak about strengthening vaccine confidence in pediatric and family practice settings in the midst of the COVID-19 pandemic. I think it's worthwhile to frame discussions around vaccine confidence with the fact that vaccine acceptance overall remains high among US parents. And high vaccination coverage results in substantial reductions in morbidity and mortality. Vaccines, in a way, are a victim of their own success. It's because of the successes of vaccination programs that vaccine-preventable diseases are typically rare, and parents generally have not firsthand witnessed those diseases or their devastating effects, which sometimes causes them to question the need for vaccines to prevent such diseases. The vast majority, or nearly 99% of US children have received any vaccine by 2 years of age, and over 94% of kindergartners have received state-mandated vaccines for school entry. Vaccine complacency and concerns have been increasing in recent years. So from the time period 2001 through 2019, the proportion of parents stating that vaccinating their children is important decreased from 94% to 84%. Although the proportion of parents who have heard about the advantages of vaccination increased during this time period, the proportion who have heard about the disadvantages of vaccination increased to a greater extent. And lastly, the proportion of parents reporting that vaccines are more dangerous than the diseases they prevent also increased during this time period. Vaccine delays or refusals are a growing concern. So when looking at children 19 months of age, 63% have been vaccinated according to the recommended schedule, and roughly 1/4 have been vaccinated to an alternate schedule. And 2.5% of kindergartners have a vaccine exemption, and the rate of those exemptions has been increasing slightly over time. Vaccine hesitancy can be viewed as being on a continuum. So one end of the continuum represents refusal or delay of vaccines, despite the availability of vaccination services. And the other end represents folks who accept vaccines, but accept them with some indecision or a state of doubt around their decision to accept vaccines. This slide depicts data from a survey of over 2,000 parents assessing vaccine hesitancy. So 6% of parents reported hesitancy related to the routine childhood vaccinations, while 26% reported hesitancy regarding influenza vaccination. Some reasons for that disparity could be that influenza vaccination sometimes isn't seen as part of the recommended child vaccination schedule since it's administered annually. The contents of influenza vaccine will differ year to year. Some parents may view influenza disease to be more mild than other diseases for which vaccines are available. And then there also had been some periods in which effectiveness was lower for influenza vaccine due to a mismatch of the strain with the strain circulating in the environment. So the reasons why parents are hesitant to vaccinate are varied and include distrust in the vaccine industry or distrust in the government, a low perceived risk of disease, the feeling that too many vaccines are being administered together, and this might overwhelm their child's immune system. They might have some concerns about the safety of vaccine ingredients, or just feel that vaccination is unnecessary. This slide depicts the proportion of US adults who say the benefits of MMR vaccine outweigh the risk. So overall, 88% of US adults stated that the benefits of MMR vaccine outweighed the risk. This proportion does vary by demographic characteristic. So among whites, 92% stated that the benefits of vaccine outweighed the risk, compared to 78% for Hispanics and 74% for Blacks. For persons in the upper income bracket, 95% stated that benefits outweigh risk, whereas for the lower income bracket, 81% stated that benefits outweigh risk. And then similarly for college graduates and persons with a high school or less education, those percentages were 93% and 83% respectively. And I should also note that these data were as of 2019. This survey was also conducted in 2016. And while the overall percent remained at 88% for both of those years, some components of the survey did reveal that vaccines were being perceived as more favorable in 2019 compared to 2016, possibly related in part to the measles outbreaks that occurred in the New York area in 2018 and 2019. This slide shows that vaccine access issues and disparities persist, both by demographic group and also by vaccine. So on the left is coverage for at least one MMR dose by 2 years of age. And the dark blue circles represent the referent group. So even between the states, vaccine coverage varies. Coverage for MMR is greater for children with private insurance compared to those with no insurance or with Medicaid. It's greater for those at or above the poverty level versus below. It's higher among Asian children compared to white children, and also to a lesser extent, but still statistically significant, higher from children residing in an MSA principal city as opposed to a non-MSA city. Regarding up-to-date status on HPV vaccine among 13 to 17-year-olds, you can see there's much variation with vaccine coverage by state. Adolescents with private insurance have higher coverage than those with no insurance, but lower coverage than those with Medicaid. Adolescents below the poverty level have higher coverage compared to those at or above the poverty level. Black and Hispanic children or adolescents have higher coverage than white adolescents, and those residing in an MSA principal city have higher coverage than those not. So high coverage is needed in all communities to protect against vaccine-preventable diseases, and this slide depicts some lessons learned from the 2018-2019 measles outbreak that occurred in New York City and Rockland County. So a global resurgence of measles resulted in importation of measles cases into the United States, and pockets of under-vaccination exist, which have been fueled by vaccine misinformation. And this all led to the largest measles outbreak in nearly 30 years. Cases included mostly unvaccinated persons, including children as well as adults, and also including infants younger than 12 months of age who are not typically recommended for measles vaccination. So regarding strengthening vaccine confidence and acceptance, where do we go from here? CDC has a strategic framework called the Vaccinate with Confidence program, and it outlines 3 steps for preventing vaccine outbreaks or vaccine preventable disease outbreaks in the United States and strengthening vaccine confidence. The Vaccinate with Confidence framework consists of addressing pockets of low vaccination, of vaccine access issues, and myths and information. 3 tenets of the framework include protecting communities, So using various tools, which I'll discuss in a bit, to identify and protect communities at risk using targeted approaches. The second tenet is empowering families, ensuring mothers and fathers are confident in their decision to vaccinate through a strengthened provider-parent interaction. And then stopping myths through the use of social media and local partners and messengers to contain the spread of misinformation. So regarding protecting communities at risk from under-vaccination, strategies in this tenet include using immunization information systems and other systems to assess vaccine coverage and identify pockets of low coverage. And then leveraging the Vaccines for Children program to improve coverage among children who are not covered. Stopping myths includes using social media and working with local partners to improve vaccine messaging among key at-risk groups, and stopping the spread of misinformation and educating new stakeholders about vaccines. And there's also a very important role for the provider and parent communication. And CDC has resources that empower healthcare providers to effectively speak to parents and have conversations about vaccines in a manner that will promote vaccine uptake. So I'll switch gears a bit and talk about how pediatric providers can empower families and create a culture of immunization in their practices. So there's no single one effective strategy that works in vaccine communication. We rather refer to it as a toolbox approach. So this includes a team approach involving all members of the office staff. Providing a presumptive recommendation is associated with higher vaccine coverage compared to a participatory recommendation, and I'll discuss that in a few slides. Tailored educational materials, building trust with the parents, motivational interviewing, and I'll give an example of that in a few slides, and also the use of reminder recall systems, especially in the COVID era, where many patients have fallen behind on their routine vaccinations. So all staff play a vital role in vaccine communication, and healthcare staff who are confident in vaccines are more likely to recommend them to patients. And it's important that all staff have up-to-date information on vaccine recommendations, that they have access to clinical resources and trainings on vaccination, and also that their own questions about vaccines are answered. So this slide depicts the different phases of the office visit in which the importance of vaccines can be communicated. So starting with the check-in procedure, the receptionist can remind the parents what vaccines are due today and provide the vaccine information statements. The waiting room can have posters and flyers on the importance of vaccination for the prevention of vaccine-preventable diseases. In the exam room, a strong recommendation for vaccination should be made. Parents' questions should be answered and tailored educational materials can be provided. At checkout, the next vaccine appointment can be scheduled. And then between visits, reminder recall systems can be used to help improve vaccine coverage. So trust is the foundation for vaccine conversations. 93% of parents report that their child's healthcare provider is their most trusted source of vaccine information. And trust in the healthcare provider, either positively or negatively, impacts vaccine acceptance. It's also very important that, that trust is built early in the relationship. First-time moms actually have more vaccine hesitancy than subsequent mothers. Also, providing knowledge about vaccines before the vaccine visit is associated with increased uptake. So a prenatal pediatric visit is a very optimal time to start the discussion regarding vaccination. During newborn nursery rounds is another very appropriate time to start or to have these discussions, especially given that babies are going to receive their hepatitis B birth dose within 24 hours of life. And then the practice website and the new patient packet are also other avenues to provide this information early on in the physician-patient relationship to new parents. Most mothers make vaccine decisions for their child before or during pregnancy, and parents who refuse vaccines are more likely to start thinking about them before the child's birth. Pregnant women want information from vaccines from a pediatric provider. About a third of pregnant women have reported they did not get enough information during their pregnancy about vaccines for their child. And with limited opportunities, these women will turn to the internet, to friends, or to other less reliable sources of vaccine information. So there are two different approaches for initiating the conversation about vaccination during a vaccination visit. The participatory approach is shown on the right, and that's what we want to avoid. We don't want to say, this open-ended question, what do you want to do about Joy's shots today? That is associated with reduced vaccine uptake. Rather, the presumptive approach, which is the approach on the left, is the preferred way to initiate the conversation. So one would say, Joy is going to get vaccines today to protect against these diseases. So why do we want to use this presumptive approach? It's associated with a 3 to 5-fold increase in vaccine uptake compared to the participatory approach. And even among parents who resist vaccination after a presumptive approach, roughly half will accept vaccines when the provider follows up. The presumptive approach is associated with some greater perceived urgency on the part of the parents, and also with trust in the information received from the provider. Parents very commonly have questions. Even parents who are going to accept vaccines might want some reassurance or just a little bit more information before they ultimately decide to accept vaccination for their child. When responding to parents' questions or concerns, it's appropriate to share personal stories. So if you have children, it's appropriate to say, I have my children vaccinated according to the routine schedule. Or my niece and nephew have been vaccinated according, to the routine schedule. It's also important to provide balanced information on risk and benefits. I mean, certainly we are inclined to tell parents the benefits of vaccination, but they also want, honest information on risk. And then also conveying that vaccination is the social norm is helpful to improve confidence in vaccinations. This slide shows how communication efforts can address vaccine myths. So basically, the headlines of the communication efforts should focus on the facts and not the myths. So, the facts, the advantages or the facts should be stated first, then the myths. This slide uses autism as an example. One could state, that autism is equally common among vaccinated and unvaccinated children, that, many large studies do not find an association between vaccination and autism. It's also appropriate to provide an alternate explanation. So with the autism example, there's recent data that suggests that older parental age is associated with an autism diagnosis. And providing references are important. Certainly avoiding overcomplicated language is important. And then parents do want, a balance. They want to hear about the benefits as well as the risk. And, the risk of serious sequelae are very low. So, they want that honest information on both benefits and risk. These are some common communication traps that should be avoided. So the first one is the persuasion trap, and that's basically when the healthcare provider falls into this position as being a salesperson or trying to overly convince the mother to accept vaccination for her child. That is not effective. The data dump trap is when the healthcare provider just spews out, many data points related to vaccination. And that is also not effective, and actually sometimes has even been shown to be counterproductive, and that it may raise new concerns for a parent that didn't have, such a concern previously. And then there's also this question and answer trap, and that refers to when a healthcare provider is just asking a parent a series of closed-ended questions, and it basically doesn't lead the conversation anywhere meaningful. So some motivational interviewing techniques, which have classically been used to elicit behavior change regarding smoking cessation and lifestyle changes with diabetes, have also been demonstrated to improve vaccine uptake. So through these motivational interviewing techniques, the provider expresses an understanding of the parent's beliefs, elicits the discrepancies between the current situation and what the parent wishes for, allows the parent to express their own views, and supports the parent's confidence in their ability to change. And use of motivational interviewing for vaccine communication has been demonstrated to increase vaccine uptake by 7 to 10%. This is an example of a motivational interview between a health provider and a mother. And I won't go over the whole slide, but I'll go over some of the critical elements. So the purple boxes highlight questions that ask, what questions are on your mind? Or, it's the healthcare provider asking them other questions. Tell me what you are concerned about. Do you have other worries? So it's, asking these open-ended questions to the mother. The blue boxes show empathy, such as, you sound worried right now, or it seems like a lot, doesn't it? The green boxes have collaborative language. So engaging the mother, actively in this conversation. Let's talk about this together. Let's talk through this. Or let's talk about the 5 ingredients, and then we'll talk about the chance of your child getting a sore leg. And then finally, towards the end of the conversation, it has language geared toward a support for autonomy. So what can the mother do actively to help her child in the vaccination process? So, the provider is saying you can cuddle and provide some comforting words. Or I will ask you to watch your child, and if you're concerned about anything, bring them back to the office so we can check them. Or I'll tell you what to look for and what to do if you're concerned. So it's empowering the mother. Additional concerns for influenza vaccine are depicted here. So parents may be especially hesitant regarding influenza vaccine for some reasons I mentioned earlier about perceived low effectiveness, safety concerns, and also a perception that the vaccine can cause influenza. So some strategies for communication unique to the flu vaccine include focusing on the burden of influenza in children. How many children are hospitalized annually for influenza? Rebranding the flu vaccine as a routine vaccine using the presumptive approach. Reassuring parents of the safety. Over 170 million doses are given annually. And then also discussing the efficacy of flu vaccination in the prevention of severe disease. So when a parent refuses a vaccine at one visit, it does not necessarily mean that the parent will continue to use the vaccines at future visits. And it's important to maintain rapport with the parent and leave the door open for future discussions. And before the parent leaves the office, at least one action item could be created, such as scheduling the next visit or providing some information for the parents to read that addresses their question. And then I think that ends the first part of the presentation, and I will now turn it over to Mrs. McNeil, who will discuss some more specific data related to vaccine services in the era of COVID-19. Thank you.
Thank you so much for having me today. I'm going to speak today about routine childhood vaccinations during the COVID-19 pandemic. We have seen substantial disruptions to outpatient medical care during the COVID-19 pandemic. As the number of COVID-19 cases increased and stay-at-home orders were implemented this spring, we saw a nearly 70% reduction in outpatient in-person visits before starting to rebound. Unfortunately, pediatrics has been among the hardest hit specialties. We saw a 47% cumulative decline in visits from March 15th to June 20th, 2020, which is much higher than some of the other primary care specialties where vaccines may be administered. We have seen disruptions in outpatient medical care among all pediatric age groups during the pandemic. The different colored lines show different age groups, and we can see that even though children less than 2 years of age didn't have as great of reductions as some of the older age groups, they still reached 40 to 50% reductions at their peak before starting to rebound. And at this point, children aged 3 to 5 years remain lower than the other pediatric age groups in terms of their visits to a pediatric provider. So not surprisingly, in this context of reduced healthcare utilization among children, we have seen substantial reductions to routine childhood vaccination. This figure shows the weekly decreases in VFC, or Vaccines for Children provider orders, for pediatric vaccines through May 10th, and this is for all non-influenza vaccines. We can see that starting in late March, we saw substantial reductions in the number of pediatric vaccines ordered in 2020 compared to 2019. We also saw the same pattern for measles-containing vaccines, which of course is of great concern in the United States because you just need a small reduction in coverage to lose herd immunity and start seeing cases in outbreak. This led us to ask, what is the current capacity among pediatric providers to administer vaccines? Is this reduction due to fewer providers or closed offices, or more due to reduced parental demand? So we tried to explore this issue a little bit more through a survey of providers participating in the VFC program. The Vaccines for Children program provides vaccines at no cost to eligible children, and this encompasses about 38,000 enrolled practices, or about 86% of U.S. pediatricians. We conducted a survey among a subset of VFC enrolled practices and found that approximately 90% are open, and among those, 96% are offering vaccines, and 59% are accepting new patients. So what the high-level results of this survey showed is that our immunization infrastructure remains strong during the COVID-19 pandemic. As of May 2020, our immunization infrastructure is sufficient to meet patient needs and ensure catch-up vaccination, though some access issues do remain. The majority of providers will be able to administer vaccines during the critical back-to-school period, but to help ensure that routine childhood vaccination services get back on track, we still need a lot of effort to support providers and parents. So to summarize, these are some of the CDC activities that are being conducted with our immunization programs and partners to support routine childhood vaccination. First, monitoring vaccine service delivery to inform targeted intervention. It is really important that we continue to monitor the data on vaccine coverage and uptake, both at the individual provider level and through public health. It is important for all of us to be monitoring what is happening so we can better understand how to address this problem. We are also providing support to providers through the development of guidance and support materials, and I'll go through some of those in the upcoming slides. We're also working with our immunization awardee partners to identify and respond to disruptions in vaccination, to promote catch-up vaccination through reminder recall systems, and to support access to vaccines by identifying gaps in the VFC provider network, and identify policy interventions to support healthcare providers. It's also important for all of us to make sure we are supporting communications and providing information on the VFC program to families and working on a plan for back-to-school vaccination activities during the summer, as well as influenza vaccination this fall. Next, I'll walk through CDC's interim guidance for immunization services during the pandemic. First, in our guidance, we really try to emphasize that routine immunization services remain critical even during the pandemic. Routine vaccination prevents illnesses that lead to increased medical visits and hospitalizations, further straining the healthcare system. And influenza vaccination will be critical to reduce the impact of respiratory diseases and the resulting burdens on the healthcare system. It is also important that we maintain routine vaccination across the lifespan. Some of our earlier guidance focused on the youngest children, those under 2 years of age, but we're really now emphasizing that vaccination is an essential medical service for all age groups and populations. So for children and adolescents, it is important to reschedule any missed well-child visits or vaccinations. And even though we are emphasizing this for all children, we do have some guidance on how to prioritize those on who to call in first. So starting with newborns, infants, and children up through 24 months of age, then young children, and extending into adolescents. Also, for pregnant women, if vaccination has been delayed, administering vaccines during the next in-person appointment. And for adults, we are recommending to administer all of recommended vaccines, but of course it's especially important in older adults and those with underlying conditions because they're more susceptible to severe disease and outcomes from vaccine-preventable diseases. Our decreasing immunization rates mean it's particularly important to assess the vaccination status of all patients to avoid missed opportunities and ensure timely vaccination and catch-up, and to administer all vaccines or overdue vaccines according to the recommended CDC immunization schedules during each visit. There haven't been any major changes to any of our vaccination recommendations. They're still the same recommendations that we had before the pandemic, but we're really trying to emphasize catch-up and catching people up on all of vaccinations that they're due for at the same visit, not only to protect people earlier, but also to reduce the number of vaccine visits that they have in order to make the healthcare system and get caught up. What are some of our strategies for catch-up vaccination? So we know from a lot of evidence that there are certain strategies that have been demonstrated to help improve vaccine uptake and coverage. So these are very evidence-based strategies that are helpful regardless of the situation, but they're especially helpful given we are here in a pandemic where we've seen such disruptions to our routine healthcare services. These include reminder recall systems, forecasting through electronic medical records, or immunization information systems, and standing orders. These are concrete ways that we can get patients caught up on vaccinations as soon as possible and avoid any missed opportunities for vaccination if they're in the office for other reasons. A little bit more about vaccine administration during the pandemic. Vaccination in the medical home is ideal to ensure that patients receive other preventative services that they may also have been deferring, because vaccination isn't the only medical service that patients have been missing during the pandemic. So we want them to get caught up in all of these preventive services, including vaccination. Regardless of the vaccination location, so whether it's in the medical home or in a pharmacy or pop-up clinic or drive-through clinic, regardless of the location, CDC's best practices for storage and handling of vaccines and vaccine administration should be followed. Also, it's important that we are documenting information on vaccines administered so that providers have accurate and timely information on vaccines received and to ensure continuity of care in the setting of COVID-19 related disruptions. So it is especially important now as people might be going elsewhere for vaccines during the pandemic, and people may be changing the way that they access care. So it's really important that records follow them in terms of their vaccination history. Just a word of note on vaccination of people with confirmed or suspected COVID-19. Routine vaccinations should be deferred in people with confirmed or suspected COVID-19, regardless of symptoms, and this is because we don't want our healthcare workers or other patients to be exposed in the office to somebody with COVID-19. Normally for people with mild to moderate illness, it isn't a contraindication to vaccine, and there isn't anything specific about COVID-19 that we're talking about. It's more to avoid exposures within the healthcare system and to avoid risk of transmission to others if that person were to come into the office for vaccination. We also recommend that providers follow CDC guidance to prevent the spread of COVID-19 in healthcare settings. The same guidance that CDC recommends for all healthcare settings and outpatient visits are the same recommendations that we have for people coming in for vaccination visits. So this includes things like screening patients for COVID-19 symptoms before and during the visit, ensuring social distancing of patients, limiting and monitoring facility points of entry, and installing barriers to limit physical contact with patients at triage, implementing policies for cloth face masks for people 2 years of age and older if they tolerate them, ensuring adherence to respiratory hygiene, cough etiquette, and hand hygiene, and surface decontamination. So the same recommendations that are out there generally for healthcare settings are the same ones that should be followed for vaccination. We do have some additional guidance for the use of appropriate personal protective equipment. Face masks are recommended for all healthcare providers. And again, this is consistent with CDC guidance for healthcare workers in general. Procedures around vaccination are not considered aerosol generating, so N95 masks are not recommended for vaccine visits. Also consistent with the general CDC guidance, we recommend eye protection based on levels of community transmission. So in an area with moderate to substantial community transmission, eye protection is recommended. And in areas with minimal or no community transmission, eye protection is considered optional. In terms of glove use, for administration of intranasal or oral vaccines, it is recommended that healthcare providers do use gloves. For any intramuscular or subcutaneous vaccines, the recommendation would be per our usual recommendations, which is that gloves are optional. But regardless of whether gloves are used or not, it's really important to ensure a good hand hygiene during these vaccination visits. Again, it is also important to ensure physical distancing during vaccination visits to the extent possible. Some strategies include separating sick from well patients, and this could be scheduling well and sick visits at different times a day, or placing patients with sick visits in different areas of the facility or different locations if you're in a multi-location practice setting. Also ensuring physical distance measures with at least 6 feet where possible during all aspects of the visit, post-vaccination monitoring, etc., and using strategies such as physical barriers, signs, ropes, and floor markings. Also, to the extent possible, trying to reduce crowding in the waiting room, for example, by asking patients to wait outside in their cars until called in, can be one strategy for reducing crowding. In addition, reassuring parents that through communication that is really important. Healthcare providers are consistently ranked as one of the most trusted sources of information for parents about their child's health, including around vaccines, and for this information and for information around COVID-19. So hearing directly from their provider can be really helpful in reassuring patients and parents that it's important to come in for their well child visits and vaccinations. And also discussing these safety protocols with them can be very helpful. Also, as I mentioned before, promoting awareness of the Vaccines for Children program among parents is also important. Prior to the pandemic, about 50% of US children were eligible to receive free vaccines through VFC, and we know that this number is probably higher now and that there are probably more eligible children due to parents losing their employment and losing their health insurance. But some of these more recently eligible children and their parents may not be aware of the VFC program because they've never had to access it before. So helping to promote awareness is important so that parents who may be worried about coverage for their children's vaccines can be reassured. And so promoting that messaging in any information that you provide to your patients can be really helpful as well. Preparing for back to school is another important step. Of course, it's really uncertain what is happening with schools reopening right now and whether kids are going to be going back in person. But we expect that many school-age children will be at risk for under-vaccination and for non-compliance with school vaccine requirements. And so some strategies that could help with this include augmenting back-to-school vaccination clinics to ensure that children have an opportunity for vaccination. Fortunately, we've started to see signs of recovery in the routine childhood vaccination. In the last couple of months, since around mid-May, we have seen the number of doses ordered for children in our VFC program has started to come close to what we saw during the same time period in 2019. However, unfortunately, we haven't really started to see a lot of signs of catch-up vaccination. So all of those children who missed their doses in March and April, we haven't yet seen that our recent doses are increased, which would suggest that we've made some catch-up. So we've made progress, but we're not out of the woods yet, and we still have a lot of work that needs to be done to get kids caught up on their vaccines. So before closing, I wanted to provide a few resources for routine childhood vaccination during the COVID-19 pandemic. On CDC's website, we have a couple of pages. We have a page geared toward parents that has information and magazine type articles and links to other resources. We also have a page for providers that has some newsletter content and downloadable social media content. There's also AAP's Call Your Pediatrician campaign, which again provides a lot of downloadable and shareable resources to help get the word out to your patients. And the Immunization Action Coalition also maintains a repository of resources, which have a lot of examples and samples of what others have done to promote vaccinations. For example, what other state immunization programs and other partners have done to get communications messages out there. So there's a lot of good resources that are available. So in conclusion, there's been substantial disruptions to routine childhood vaccination services during the COVID-19 pandemic, though we've started to see signs of recovery. But regardless, we still have a lot of work to do, and all of us, providers, immunization programs, partners, can help to get vaccination back on track by supporting catch-up vaccination efforts and communicating with parents about safe vaccination during the pandemic. And so with that, I will turn it back over to Dr. Sarah Sheely to review some additional communication resources that are available for healthcare professionals and parents. Thank you.
This slide here depicts some short videos of providers stating how they recommend vaccination to parents, and we have a library of these specific videos targeting vaccination children or adolescents or influenza vaccination or HPV vaccine. So I'd encourage folks to check those out. We also have a customizable slide deck that physicians or vaccine coordinators can be used when they train their office staff on vaccines. This is a series of educational resources we have, and the Immunization Services Division has a robust continuing education program. So continuing education or CME credit is offered for most of these. And then we also have a collaborative effort with Medscape and have some educational programs there. And I'll probably just let folks look through the rest of the materials on their own.
Thank you so much, Dr. Sheely and Ms. McNeil. I realize we are at time now. We will follow up with additional resources. We would also, again, of course, like to thank you for joining us for this webinar. There should be an evaluation that pops up when you leave the webinar, so please fill that out. Everything, all of our immunization webinars are posted online at www.phf.org/immunization. And you'll be able to access, at the very least, the slides from the webinar there. Please also feel free to share any additional comments you have with us through the chat, the questions box, now, or reach out to us. So thank you once again for hanging with us, and we hope you enjoy the rest of your day.